Hi, everybody. Pat Moody with another edition of Moody on the Move, taking you behind the scenes of great businesses and organizations across the region to give you a peek behind the curtain as to what's going on in their individual stories. Today, we're taking you to the executive suite at Corewell Health South in St. Joseph. Moody on the Move is made possible by our friends at Campbell Ford in Niles, where you'll find that the best bottom line is always at the state line. And don't forget, you can watch this or any other edition of Moody on the Move anytime at moodyonthemove.com. Today, we're joined by Natalie Baggio, the president of Berrien County's largest employer, Corewell Health South, our sterling hospital and healthcare system for the region. And Natalie, first and foremost, congratulations on your elevation to the CEO role in the past year or so after the retirement of Dr. Lauren Hamill. I know that your achievement's been celebrated on many levels, and your team just continues to shine, and I love that. Especially because, having personally benefited from the amazing advancements here at Corewell, I'm delighted to keep the spotlight on the efforts that you're making here to expand access to care in Michigan's Great Southwest. Not only in primary care, but in urgent and specialty care realms as well. Give us an update on that Corewell story and where you're headed.
Yeah, as I've entered into this position and have been out meeting people within the community and listening and hearing what's important to them, access to care is number one. So we have been intentionally focusing on not just accessing primary care, but our specialty services as well. And we're continuing to grow our footprint. So you'll see now that we have access to primary care and soon specialty care in Dowagiac. We just opened a new cardiovascular practice in Watervliet. And then we're expanding our Bridgman clinic to a walk-in clinic in addition to primary care. And we're going to have physical therapy there.
That's a great presence. It's a good-looking building down in Bridgman now. Very nice. So I love the fact that you're going to reinvigorate the story of all of this through the launch of a new podcast in partnership with our team at Midwest Family. I think that's really cool. Core Conversations with Natalie is the story there. And we're going to have a little sneak peek at the podcast studio where you host, and we'll share that here. So what can we expect from that new series going forward? What do you hope to do there?
It's a new and more modern way to communicate with our community and to share with our community not just what our strategic plans are or what we're doing, but how to help the health of our community. What type of access do we have to care? What type of new products or procedures do we offer? And also preventative wellness. So we think this is going to be a new and great way to partner with other people in the community and share health and wellness.
Well, and some great stories, too, because you'll be talking to individuals who have benefited from your care. You'll be talking to team members from your own team here, talking to industry specialists and things like that. A nice broad array of a peek behind the curtain as we're doing here today.
Yeah. And then we'll seek feedback and we can change what our focus is based off of the community needs.
And what they say.
Yes, exactly.
As the viewer. Well, another thing that just is striking, it seems like the Help Wanted shingle is hanging everywhere these days. And as cultures change all across the country, talk a little bit about Corewell South's ongoing efforts to stabilize your own workforce in the healthcare industry and how especially that is impacted by the large swaths of rural customers that we have, patients.
Yeah, I think living in a rural area makes it more challenging to recruit talent. So a couple of years ago, we started down the pathway of working with other community partners and thinking about how do we grow talent. So identifying people locally in early ages and getting them interested in healthcare and putting together pipeline programs that offer careers that are based in healthcare. And since we've been on this trajectory now for a couple of years, we just graduated over 70 nurses last year. We are building a new apartment complex here in St. Joe because we know housing is a challenge. So when you recruit people, you have to have a place for them to be able to live and stay. So we are now expanding that project, and we look to expand that into our Niles market as well. And we're going to continue to grow our pipelines in order to grow our own talent and recruit new people to this location.
I remember a program when I used to work for the chamber years ago that we had that was it took sixth graders into the workforce just to give them a look at what's possible so that they could say, I'd like to be able to do something like that someday too. And you cannot start too soon, I think, with kids.
Yeah, exactly.
Well, as I alluded a bit ago, I have personal knowledge of Corewell's depth of expertise. Your emergency room saved my life, and your cardiac team delivered a quintuple bypass to me. So I'm extremely grateful, and I'm also delighted with the fact that many of the nurses that I came into contact with during my time here were also students at LMC, and I love the fact that you're a teaching hospital in that regard. So very, very cool. How has your time at the helm here impacted your own personal life and your personal outlook?
You know, what I've really enjoyed most about this position is being external into the community and working with our partners and our patients and hearing from them on what is personal to them. And I've learned how healthcare is deeply personal and rooted in our communities. And I think for me, that's, as a nurse, that's just given me a different perspective on healthcare. And I've really enjoyed thinking through the eyes of our community and transitioning in that to our strategic vision and our future growth.
Excellent. Well, at Corewell, behind you, our name signals our bold commitment to health and wellness. As it says, at our core, we are here to help people be well so they can live their healthiest life possible. For access to the broad array of services and specialties, anytime you want to, ladies and gentlemen, you can visit corewellhealth.org. And that's a wrap on this edition of Moody on the Move. Today's episode and every episode made possible by the great people at Campbell, Ford, and Niles, where the best bottom line is always at the state line. And our thanks to Little Red Fern Productions, who always enhance the stories that we share with you. Remember, you can rewatch this or any other show anytime online at moodyonthemove.com. We'll see you next time we take Moody on the Move.